It is now 17 minutes after 7 o'clock in Antigua and Barbuda. This is Observer AM. As if on cue, some messages coming through to my device. Free COVID-19 rapid antigen testing for school children with exemption from COVID-19 vaccine. That's going to be coming up this Saturday, the 20th of November. That's a message, of course, from the Ministry of Health, Wellness and the Environment. And also on said day, said Saturday, the 20th of November, there's going to be a weekend vaccination available for students at the Multipurpose Center from 9 a.m. to 3 p.m. First and second doses of AstraZeneca, Pfizer, Sinopharm vaccines, and of course the single-dose J&J vaccine for those who really like to avoid needles. But speaking about the school mandate and the vaccination policy affecting the nation's school children is the president of the Democratic National Alliance, Ms. Joanne Massiah. She's joining us on the line. I want to say good morning and welcome. It's been a little while.
Thank you, Darren, and good morning to you and to your broad listenership, both here in Antigua and Barbuda and abroad.
All right. Well, we'll start our chat, of course, on the school mandate and the impact that it is having on children. This is something that you're particularly very concerned about. Of course, the reasons could be many, but we're going to flesh it out this morning. What's your general assessment of the way this matter has been handled by the Ministry of Education as it relates to the vaccine mandate and the impact on children?
Thank you so much for that question, Darren. But just before I answer that, I just want to just take a brief moment to encourage everybody to plant something in their backyard. It can be done, right? Get a tire, go to one of the tire places, ask them if you can get one or two, because people will say they don't have space, and put some dirt in it. You can even plant some cucumbers, anything. Put a stick in it and let it run up like on a vine. Let the vine run up on the stick, and you can have your tomatoes right there. You can take some peas out of the bag that you buy in the supermarket, which is what I do. I just planted out some the other day. I planted some black-eyed peas and some other beans, and they're growing. We can help ourselves. You can put the lettuce in the wheel. You can put tomatoes. You can put chive. You can put all these things and help to lower your own food bill. We got to be innovative in these times of multiple crises. I just had to stick that in.
I appreciate that, because a number of listeners have been messaging me this morning with the various prices. This for a head of lettuce, that for a couple of heads of broccoli.
Yes.
I mean, it's crazy. And I don't know that there's much one can do about it, aside from what you just suggested. You have any other ideas?
Well, a lot. You have to also plant what you call quick crops, crops that will grow and mature and be ready for harvest within 3 months. You have a lot of those kinds of crops, and you can extend it to 6 months, depending on what you want. But there's nothing better than a backyard garden where it comes to food sovereignty and food security. And plant some things, plant some pawpaw. You get a nice pawpaw, and you like the taste. It's very flavorful. Plant the seeds, and you're going to get, the tree sprouting in little to no time. Put down some okra seeds, dry out an okra, plant them, and you get okra. It's very simple. It just takes time. You could do it in the afternoon or the early mornings. I know people are going to say, what is the problem? But catch some water specifically for that. Even your rinse water from your dishes, that can be used and so on. Got to be creative and innovative in times of crises.
All right.
We can do this. We can do this. And if you have a lot, exchange it with your neighbor, your workmates. If you all have a little group and you say, we're going to plant, just don't plant the same things. So when you're ready to share, you can exchange and you can get your meal right there.
Yeah, interesting observation. All right, I think many will take that advice to heart, because I got to tell you, nothing focuses the mind like a crisis. Anyway.
Indeed. So back to the question.
Back to the question. The Ministry of Education, that's fine. It's timely, given the conversation taking place. But certainly the situation surrounding the nation's children. Now, of course, the Ministry of Education, and I think the Minister, when he last presented on my program, not that long ago, maybe 2 weeks ago, give or take, just after the independence holiday period, would have indicated that many of students have gotten the vaccine. Perhaps a clear majority, but there still are a number of students, for one reason or another, have not yet been able to, or have not, for whatever reason, taken the vaccine.
Okay.
How does the Ministry of Education find that balance of protecting the nation's children and, of course, protecting the rights of those who have not yet been vaccinated?
Yes. Darren, I want to, though your question is directed to the Ministry of Education. Initially, you asked, how have they been managing the crisis?
Yes.
And I want to just step back and remind people that the Ministry of Education is simply one factor in the whole dilemma, if you will, of managing this crisis. We got to put this squarely at the Cabinet's feet because they're the ones who are, coming up with these policies, which all of us have to live by. I also wish to just remind everybody that quality education enables people to develop skills and attributes to achieve their fullest potential. And also just to say that among other sectors and areas, education is the cornerstone of national development and critical to a personal development. It is also one of the SDGs. It's SDG number 4 that speaks to quality education. SDGs are the Sustainable Development Goals of the United Nations, of which Antigua and Barbuda is a member. And they have set a number of targets for the world and for countries in particular to aim to meet by a particular time frame. They missed the first time frame, and that has now been extended to the year 2030. And SDG number 4 says just in short that quality education, to ensure inclusive and equitable quality education and promote learning opportunities for all. Now, you just said that the Minister of Education opined on the program that the majority of students have taken the vaccine. Just in listening myself to a number of discussions about secondary school students and in reading some news articles, the government says that there are approximately 8,000 eligible students. Secondary school students we're talking about
right.
here.
12 to 19.
And it also opines that 6,000 have been vaccinated. That is 75% of the target group of secondary school students. Remember, government has said it has moved its herd immunity number because back in, I think it was July or so, July 21st, 2021, in the cabinet notes that came out from Ambassador Hearst, they had said that they had vaccinated, I think, just a little over 37,000 persons at that time. And so they needed to vaccinate 30,000 more to reach the herd immunity. I don't know what caused the number to move from the, let's say, 68,000 to now 80,000. I can only conclude that this new and revised target amount of 80,000 people must be based on some information that the Prime Minister and the Cabinet have that our population is 100,000 people. Because 80% of 100,000 is that magic 80,000 number, right? Mm-hmm. Now, I also wish to say that when it suits our purposes, when I say our, I mean government's purposes, we like to quote both PAHO and Dr. Carissa Etienne in particular, as well as the WHO. Now, a few days ago, sometime last week, towards late last week, Dr. Carissa Etienne, in addressing the issue of vaccinations for children, she said, and I'm quoting her, and I may just, add one or two things. She said here that PAHO acknowledges that each country makes its own decision when it comes to vaccines. However, she said that PAHO's strategic advisory group of experts advised against vaccinating children at this time. She reminded that the focus should be on vaccinating the adult population, persons with pre-existing condition, frontline workers, and the elderly. And she went on to say the objective is to protect them, this group of persons that I just spoke to, and preventing the collapse of the healthcare system and preventing governments from being overburdened. She said that the most robust evidence available when vaccine availability is low says that it is best to protect the most vulnerable population first. Because when those at greatest risk are protected, the next focus should be to immunize a high percentage of the adult population. And only afterwards, she says, should countries consider vaccinating younger groups. Now, interestingly, this morning on the ABS News, they featured the Secretary General of WHO, World Health Organization, Dr. Tedros, and he too cautioned against moving towards vaccinating children. And I'm wondering whether or not the government has heard any of these cautions, and why is it that they're not heeding these cautions?
I'll tell you what, let's pause because we have some messages we need to insert into this discussion, and we'll continue on the other side, holding the line on mandates with respect to school-aged children. It's now 7:32 in Antigua and Barbuda. This is Observer AM. We're continuing our discussion with DNA President Joanne Massiah. Ms. Massiah, what is your understanding of the reasons advanced by Dr. Carissa Etienne of PAHO and the other the doctor that you mentioned? What was your understanding of the reason that they offered for not pressing ahead with a vaccine mandate for children? Hello? Okay, I think we've lost Ms. Massiah. We'll try and see if we can sort that out.
No, I'm right here. I'm right here.
Oh, okay.
You hearing me?
Yes, I'm hearing you now. Thank you.
Sorry about that.
That's
yes.
all right.
I understand them to be saying that the priority groups are these vulnerable persons. Priority groups to include persons with underlying illnesses or the comorbidities, as we've spoken,
right,
as we often hear about.
The elderly.
The elderly otherwise.
Right.
They're talking about frontline workers, and I think that's just a broad category of persons to include healthcare professionals. And I want to take the opportunity to remind the public that when the government came out first with its mandate, it said that with effect from 20th September 2021, keep that date in mind, it gave a list of workers, employees who fell under this mandate, starting with government employees, statutory corporations and companies in which the government had majority shareholding. Yes? And it said that these groups of workers had to be vaccinated, or else come October 1, 2021, they were not supposed to go to work, and that they would not be paid, etc., right? But what was curious, and I say curious, but we all know the reason. What was curious is that the government went on to say that there was an exception to this mandate. And the accepted group, right? The accepted group was nurses and clinic staff. I'm just trying to find the exact language here.
But the nurses generally. The
nurses generally, people who work in the clinics who
right,
who are auxiliary workers and critical workers to help to keep the healthcare system afloat and functional.
Because
now,
just let me one second.
Yes.
Just to dial back a little bit. With respect to the reasons that you gave, at least your understanding of the reasons advanced by Dr. Carissa Etienne and her colleagues, that it primarily would have been based on, as I understand it, the limited availability of vaccines. But Antigua does not have a challenge with availability of vaccine, does it? I mean,
as
we do
I
have...
see it,
Yes.
let me tell you, as I see it, right?
Mm-hmm.
The government has said we need to get to $80,000. Sorry, 80,000 persons.
Yes.
Right?
Mm-hmm.
And they, in their minds, they're satisfied that we're going to get to that number by any means necessary, come hell or high water. I want to put the statistics into some perspective here because nobody's talking about statistics, right? Nobody's speaking about data from the government perspective, at least not that I've heard, with any regularity or consistency. So we're going on the premise that our population is 100,000 persons, and we're seeking to get to a vaccinated population of 80,000. Now, based on the data coming out from ABS and on November the 12th, 2021, when I say ABS, I'm talking about Mrs. Erna May Brathwaite. She puts out the dashboard to update the public, right? We're told that as of November the 12th, 2021, the vaccinated population, those who are fully vaccinated, stood at 54,221. That equates to 54.2% of our population. The confirmed cases of COVID, as of that date, 4,122, and that equates to 4.2% of our population. Now, when we look at deaths, we have 107 persons recorded as having died either from COVID, with COVID, however they classified, but they're COVID deaths as they're being categorized. That equates to 0.1% of our population. And I know people, unfortunately, this whole vaccine issue has been so politicized that people are not hearing each other. Now, I think in the management of this crisis, what we need is balance more than anything. Not just among ourselves as we discuss it, but government. Government is called upon to strike a most delicate balance. But government is not, in our opinion, government is not doing that. Government is just, dictating and making mandates, and everybody must comply, and they're not listening. Now, what is also missing from this whole discussion and persons' march towards the vaccination line is informed choice. Informed choice is absent from the management of the pandemic from inception. And we have said, and others have said, that what is required is for government to engage people in a meaningful consultative process where questions are asked and answers are given.
Yeah, okay.
People are also saying, have we explored all the other options in the toolkit, as they call it?
And what are those other options? Let's have an engagement here. What are those other options? Because as I understand,
other options are uses, for example, of in a preventive kind of way,
right,
such as ivermectin, which is promoted in other places. We also have to remember that when we look at certain countries which are fully vaccinated, let's look at Israel, for example. Israel is, and just in the Arden, help me here.
New Zealand.
Right, and Australia. They are some of the most vaccinated countries. Israel, I think, is going through its fourth wave. They're probably on their third booster, and they keep having breakthrough cases. What persons are saying who have vaccine hesitancy or who are just following this whole debate is let us explore other options. Let us focus on boosting immune system through healthy diets, through regular exercises, and so on. Right? But I want to just dial back here a bit to go back to the whole issue of the students, right? Students between the ages, or below 16, I should say, maybe below 18.
12 and up.
And I'm just talking generally.
Right.
They can't make decisions on their own. whether to be vaccinated or not in this instance. And we believe that these children are being treated very, very harshly by the cabinets. Government ought never to find itself in a place where it is so inflexible in either developing or enforcing policies, which results in this instance in children being placed at a decided disadvantage. You have situations where we have to ask ourselves, and I called around to a number of persons I know who have secondary school students yesterday and early this morning. And I'm asking them, when you took your child to be vaccinated, were they given any sorts of leaflet? Did they leave there with any educational information about what they need to do? And I'm not talking about just if you feel sick or feverish, what this vaccine is intended to do. Because a lot of children, because of their tender age, I would just say that is a primary reason, they are not aware that although they're vaccinated, that they can still contract, shed, and spread the virus, right? And so they feel they're fully protected because when they've been inoculated with, other vaccines, they're safe. And they're not necessarily following this debate in the way that we as adults are following the debate.
Let me ask you.
Right?
Let me ask you. You suggested, of course, boosting the immune system. I think you suggested ivermectin. No, ivermectin
as one option.
Toolkit. Right. So it's a toolkit, including the vaccine.
It's a toolkit.
Right.
But the only option we seem to be exercising
is the vaccine.
But
is that fair, though?
What we do
is that
know,
fair?
let me just finish. What we do know, Darren, is that
I haven't gotten a chance to ask a question.
Do not provide. I'm just finishing, my God. They're not providing what we understand historically and traditionally and usually and normally as immunity, right? And so we keep hearing that the protection, what they're providing essentially is protection. And this protection, we're told, and the figure changes very often, would give you protection for maybe 6 months. And then after that, what? You are likely
but in
to
all
be
fairness,
vulnerable again.
you would
so
appreciate...
you have to get a booster.
Right.
And people are asking, when do the boosters stop? That's what they're asking.
You would appreciate, fair enough. You would appreciate, but by the way, Ms. Massiah, when I have guests, let's put it this way, certain types of guests, especially like ministers of government, personalities within the opposition, Barbuda Council, etc., when they, take a little time to expound on their particular point, and the time runs out, they usually accommodate me after the news. I hope that you're going to extend to me a similar accommodation, because I do have some questions for you. The first of which is, we're just getting to understand, and when I say we, the globe, the world, the scientific community. And so you would appreciate the fact that we're figuring things out as we go along, as far as this virus is concerned. And the promise of the vaccine, as I understand it, is to prevent death and prevent hospitalization and death. Which
among whom? Because we also have to look at the recovery rate.
Okay.
And
have you?
This is why the focus has been on persons with comorbidities and elderly persons, because they are in what you call the vulnerable category. If I have hypertension, diabetes, heart disease, I am a most vulnerable person. And anything that attacks my immune system further compromises my vulnerability, right? So the caution from Dr. Etienne and the Secretary General of WHO, yes, a part of it is about vaccine scarcity.
Right.
But it is also asking governments, do not lose sight of the objective here.
Understood.
Hence,
let me tell you.
The need to focus on the adult population.
Okay. It is now 8 o'clock in Antigua and Barbuda. This is Observer AM. Darren Matthew Ward in your company, and we're going to continue our discussion We're going to continue our discussion with the DNA President Joanne Massiah in just a moment after I share with you a few quick messages. On Tuesday, today, the 16th of November, the APA Mobile Payment Center will be located at Caribbean Cinemas. That's located, of course, on Fries Hill Road. They'll be open from 9 a.m. to 1 p.m. Services include the payment of all utility bills and the purchase of iNet products and services. All right, ladies and gentlemen, bear that in mind. I do believe that President of the DNA, Joanne Massiah, is joining us once again on the line. Miss Massiah, you're back with us?
I'm just sort of changing rooms because I hear the traffic is creating some kind of interference.
We're hearing that you're close to a road and it might be distorting the audio a little bit. Well, but let me first ask you, you're speaking about, protection of the vulnerable, the attacking or vaccinating, rather, is a preferred word, the vulnerable groups, sorry. But you're vaccinated and you've been vaccinated for quite some time, right?
Listen, I was waiting for you to ask me that question, and my answer is my health care issues and the management of any aspect of my health is a private matter that I will not discuss, because I don't think you'd be comfortable asking me what were the results of my last pap smear or what were the results of my HIV test, okay? Suffice to say, I don't generally have a problem with vaccines. The DNA has no problem with vaccine.
Just bear with me.
Generally speaking.
Bear with me a second.
I would have gone to school. I would have gone to university. So clearly, I would have all of my shots related to MMR, polio, whatever. I've had tetanus shots, etc., etc.
But I wasn't quite. I don't know if you understood my question or what I was trying to get.
Go ahead. Ask again.
You have been vaccinated for some time. I'm referring to COVID-19 vaccine, as I understand it.
That is what my answer is directed at. I am not. I believe a person's management of any aspect of their health is a private matter, and only those who need to know should know. And this is why I asked you. I don't think ordinarily you would be comfortable asking me about any other aspect.
I've asked other leaders. No, I wouldn't. I've asked many other.
That is my answer.
The leaders.
That is my answer.
Leaders. I guess the point that I want to make, which you perhaps don't wanted me to make, is that as far as I'm aware, you've been vaccinated for quite some time, and I'm not people might argue or say, not knowing what your health condition is, that you may not be a member of either of those groups that you pointed out. Those who are elderly, I don't think you would categorize yourself as elderly. Certainly you're a public figure, so people naturally would want to know whether or not, what's your stance on vaccination personally, in terms of whether or not you've availed yourself of that opportunity. And so therefore, based on what you said in the first hour, attacking or dealing with those who are in vulnerable groups, you may not necessarily fall into, you're certainly not a frontline worker or an elderly person or someone who is considered to be, particularly vulnerable, but you took advantage of the opportunity of getting the vaccine because you understand the benefits.
I am neither confirming nor denying that. That's what I'm saying. That is my private affair.
But as a public figure...
let's move on. Because you don't know whether I have underlying issues. You don't know. You don't know whether I have diabetes or I have hypertension or I have any other NCDs. You don't know that. And that's not something I'm prepared to discuss. That is my private health matter that I'm not prepared to discuss. Let us get back to the general issue about the matters at hand.
You suggested a part of the toolbox is ivermectin.
Yes. Well, as one of these things, you yourself just said
allow me to finish. I haven't answered. I haven't asked the question.
I'm sorry. Go ahead.
Right.
Go ahead.
Ivermectin, as I understand it, is an antiparasitic which was devised for the use in animals. That's my understanding. And I need to ask you, what scientific evidence do you have? Since we're speaking about evidence and data, what data and scientific evidence do you have that ivermectin is a proven effective treatment for COVID-19?
You see, I read extensively on diverse matters. I always look at both sides of any argument, right? What you just said about ivermectin, there are two types. There's one that is for animals, and there's one that's for humans. And what I'm going to do today, I'm going to try to find what I have in terms of what is safe for humans and share that with you so that you can have another perspective or a broader perspective and you can understand, okay? You yourself just said prior to the break that that it's COVID-19 is new, right, and that the scientific community is still figuring things as they go along. And that's it. Nobody has the answer. If they did, we would not be seeing wave after wave after wave, and the vaccines would not just offer protection, they would offer immunity. So what we're saying is let all ideas contend. And this is what a consultation, national, regular, would do. It would give the persons who manage our healthcare, our educational system, the government generally, the opportunity to hear from others. I have never in my life, ever, and it's a part of how I was raised, I don't ever presume to have all the answers. And being in organizations, you know that. Being in business, being in school, you know that. Right. You know that you have to solicit and elicit ideas from other people so that you can arrive
at a conclusion,
consensus,
I appreciate
and a decision.
But just to go back to my question,
would resolve a problem.
Going back to my question, you're suggesting that ivermectin is a part of the toolbox. And we are aware that a lot of resource has been poured into the development of these COVID-19 vaccines, specifically research and development has been poured into the vaccines specifically to treat this specific virus. Ivermectin is something that was developed years ago before COVID-19 ever existed. My question to you is, do you have access to any data to be saying to the public here this morning, as a leader of a potential government in waiting in Antigua and Barbuda, that ivermectin is a proven treatment for COVID-19?
I have listened to doctors and to patients, and I've heard their testimonies, and who have said that they were treated in the early stages and that it worked. Okay, every day the vaccine manufacturers and the scientists, they are testing and they are having trials with the expectation that someday soon they can find the silver bullet, if you will, to COVID.
And we all hope they find it.
That is acceptable. But at the same time, people are concerned, for example, about their inability to hold, whether it's vaccine manufacturers, doctors, governments, liable if something adverse should happen to them. And we're not trying to be argumentative here. We're having a discussion, Darren.
Yeah, absolutely.
We have to put everything on the table.
Absolutely. I fully agree with that. Let me ask you this further question. Do you believe in the concept, though, of herd immunity? Do you believe that we ought to achieve a particular target in order to create a level of immunity against COVID-19 that it just totally reduces the spread of the virus, at least to the extent that, let's say, for example, we've gotten a handle on polio. We've gotten a handle on a number of other illnesses for which we would have taken vaccines over the years. Do you believe in that concept?
I think that's apples and oranges. The reason I say that is because polio, MMR, and these other vaccines provide immunity, meaning once you are vaccinated, you're not likely to contract any of these illnesses. Not so with these COVID vaccines because they are still in trials, they're still trying to figure it out, and so on. If it were the silver bullet, Darren, we would not be seeing the kinds of outbreaks in Israel, in New Zealand, in Australia, in the United States. And so the vast majority
of them, though,
with a new disease.
Yes, we're trying to figure things out. I understand.
They're trying to, and I'm saying that is acceptable.
No.
But don't tell me that the vaccines that are available for COVID are the same like the ones we get as children. It is not the same. They're apples and oranges. Do I believe that one day we will find a vaccine that will provide immunity?
Ms. Massiah,
I am optimistic that
let me make
but
this
the
point.
The fact of the matter is we're not there yet.
Okay.
And so we were talking about children. We're talking about whether or not this policy decision by the government will down the road create a problem where now, in denying children the access to the school compounds and the opportunity to learn, whether we are creating deliberately or inadvertently
Ms. Massiah,
a two-tiered system.
I understand.
Where some children
just bear with me a second. Just bear with me a second. Well,
get the full
you're taking a while.
education.
I need to ask some questions, but go ahead.
Yeah, but I'm answering.
Yeah,
you may
a
not
while.
like my answer.
No.
This
No, my friend. This is not about liking.
Of course, this is for public education consumption and to stimulate discussion.
Mm-hmm.
And we can't sweep the realities. We can't sweep the effects of this decision under the rug.
Okay.
We had a principal just Sunday on Observer's Big Issues speak to the fact that children, a number of children in fifth form, who are set to take their CXCs, will not be able to do so unless there is a change, because they sit their exams at government schools, which is a government property. They have been studying and preparing for this day in fifth form, from first form to fifth form, where you prepare yourself, where you sit your exams, and you're graded, and that in part determines the kind of job you get, the access to university and college, and so on and so on. The ramifications are great, and our children should not be penalized.
Let me ask you this. What is your understanding of the promise of the vaccine? Because my understanding is that it is to reduce hospitalizations, or reduce the likelihood of being hospitalized, and reduce the likelihood of death. And the evidence is overwhelmingly.
Among which group, Darren?
I'm speaking
population?
One second. I'm speaking generally. Okay? I've seen data from the Bahamas. I've seen data from the United States. I've seen data from Israel and Germany, areas that you've cited recently as having third and fourth waves. And the overwhelming evidence is that the majority of those, people who've been given the vaccine have contracted COVID, but the overwhelming evidence is that those who are seriously hospitalized and dying are those who are unvaccinated. And if you still have a significant population of unvaccinated, you're not going to have this level of immunity or protection that you would have with a polio vaccine that has been distributed and basically been in existence for decades. It's not the same. It's not the same thing. And so my question to you is, what is your understanding of the promise of the vaccine?
Let me answer you this way and say that whenever I see data, I interrogate the data. And that is what has to happen. Even right here in Antigua and Barbuda. Let's not go anywhere else.
The majority of people died in the hospital.
Hold on.
The majority of persons, one second. I have the data from Mount St. John. And the clear majority of persons who have died in Mount St. John were unvaccinated. So that tells me something.
And I would also tell you, virtually more than 90%, more than 95% of these deaths. What else do they say? They had underlying illnesses. And this is the point I made, that persons who are immunocompromised, it may not have been COVID. It could be anything else. Say they get pneumonia or something. Their systems are going to be further compromised. I wanted to look at the recovery rate, because when I did my converted, the statistics coming out of the Ministry of Health as put out by ABS in terms of the recovered cases.
Bear in mind, it comes from, one second, that's another point. That's another point. It comes from the Ministry of Health.
Contracted COVID.
Yes.
The 4,122 persons, of that number, 3,916 have recovered. That's what our government data tells us. Okay. That number equates to 95%. So we have an excellent track record, as in every other country, as in most countries, of more than 95% of persons who have contracted COVID have recovered. And that must mean something. That is what gives us hope. You ask what the vaccine is supposed to do at this stage, based on what the scientists are saying and what the medical persons are saying, the vaccine will provide an additional layer of protection.
Okay.
It's going to prevent hospitalization. It's going to prevent deaths. And the question is, among which group? And I am suggesting to you, it is among the vulnerable groups, which PAHO and the WHO always highlight in terms of ensuring that they are vaccinated.
Do you have the data to support that position?
Which position?
That it's among the vulnerable groups and not among the other sections of the population.
Yes, the data is. Let us interrogate what comes out when people die. What comes out when people die here in Antigua and Barbuda? 47-year-old male, came in, respiratory issues, had to be intubated, died 10 days later. The individual had underlying illnesses. 95-year-old woman came in, partially vaccinated, unvaccinated, underlying
that's
issues.
hardly data,
and that is the point. That is the point. Seldom, if ever, have we heard of a fully healthy person, no illnesses, no NCDs, no other underlying issues, die from COVID. And you know what? We will never be able to say with 100% accuracy what they died from. You know why? Because whenever there is a COVID death, no autopsy. Very straight away.
Okay.
And
let me
so
ask you
we
this.
will never
What's your
be
suggestion?
100%
What's your suggestion for the
certain.
Ministry of Education in order to protect those children as far as their educational opportunity is concerned? What's your recommendation? Because the government will argue they're trying to prevent a run on the hospital in terms of being overpowered with numbers, as was the case not so long ago. And so their objective is to increase the rate of vaccination. You're suggesting that a different path should be chosen, or at least not the approach that the government is taking. What is your recommendation as a potential leader in this country? What is your recommendation?
My recommendation is it's not too late to engage the people. It is not too late to continue to educate people. It is not too late to try to persuade those persons who fall into vulnerable groups. It is not too late to try to persuade the adult population to become vaccinated. When you turn your attention to children in the face of recommendations from PAHO and WHO, it suggests to me that, as I said earlier, you intend to reach your 80,000 target number by any means necessary. It doesn't matter. I heard one doctor on Sunday say he was aware of a 7-year-old in a family who had COVID. What he didn't say is whether this 7-year-old has recovered. What he didn't say is that the hospital is overrun by children who have contracted COVID and are dying. And what we are saying is that given that the very scientists and the very doctors are saying and cautioning that persons who are vaccinated can still contract, shed, and spread the virus, given that persons who are vaccinated are still encouraged, like the rest of the population, to wear your masks, to practice good hand hygiene, and to social distance. We are all, both those persons who are vaccinated and those persons who are unvaccinated, we are still all at risk from contracted COVID, because what the vaccines do, and we're told this every day, is to offer a greater degree of protection and not immunity.
So in other words, you think there should be more consultation and dialogue and information sessions with the population? That's your essential suggestion.
We've said so from the beginning.
Okay.
And we're saying, given that other data, because I don't think we've done the studies here, maybe we don't have enough children infected to know, but in other places, we are told that children have an admirable recovery rate.
Okay.
And so why target them now? Why have a policy when you have out of your 8,000 eligible student population, you're saying approximately 6,000 have been vaccinated.
Thank you.
That's 75% of that population. We're saying, why have such a harsh and inflexible policy?
Gotcha.
Right? Why not? If you're going to test everybody.
Well,
Test
they're looking at the area they're looking into the area of testing. I think I read it before we started our discussion this morning. But I tell you what, we got to go. We're way over time.
Thank you so much.
You're very welcome, and you're welcome anytime.
And everybody else.
Yes,
and
thank you so much.
Practice good hand hygiene, social distance, wear your mask. It is when we become complacent that we expose ourselves to greater harm and danger. Yes?
Gotta go.
Thank you so much.
Thank you. Blessings.
Bye-bye.